Calendula officinalis is a marigold plant, and it's historically been used to treat different ailments, including many affecting the skin, such as healing of wounds. The medicinal part of the plant is found in the deeply coloured orange, yellow and flower. The colourful petals are rich in flavonoids, naturally occurring compounds found in vegetables and fruits. They've been shown to exhibit anti-inflammatory, anti-thrombogenic, anti-diabetic, anti-cancer and neuroprotective activities through different mechanisms of action in vitro and in animal models. Calendula is a member of the Asteraceae family. According to the USDA, its native locations are in Canada and the lower 48 states of the US. It's an annual plant, easily grown in average, moderately fertile, well-drained soil in the full sun. Calendula oil is made by infusing the flowers in a carrier oil, such as olive oil or coconut oil. The oil can then be used on its own, or as an ingredient in ointments, balms, creams or lotions. It can also be produced into a tea, a tincture or a capsule form. Calendula has been used to treat a variety of ailments affecting the skin, as well as infections and fungus. Research suggests that calendula might be effective for treating diaper rash, wounds, vaginal yeast infections and other skin conditions. Calendula has also been used as a pain reducer and an inflammation reducer. It's also used as an aid in treating cancer, specifically for treatment-related side effects like radiation. Some research suggests that calendula might be useful as a sunscreen. Others use calendula simply as a moisturizer. The active ingredients of the calendula flower are naturally occurring chemicals such as triterpene saponins, triterpene alcohols, and flavonoids like quercetin. The photoprotective effect of the topical gel formula is thought to be associated with an improvement in collagen synthesis in the subepidermal connective tissue. It's thought the chemicals in the calendula enhance new tissue growth and wound healing and decrease inflammation. Animal studies have shown a relationship with calendula use and the improvement of wounds. A recent study published in the Journal of Family Medicine and Primary Care examined the effectiveness of calendula ointment on cesarean scars in 72 women. The researchers found, compared to the standard hospital treatment, the women who were treated with the calendula ointment had a quicker healing time. They reported their incisions to be less red and swollen. In a 2016 study published in the journal Wound Care, researchers used Calendula officinalis extract on people with venous leg ulcers. Their findings indicate those treated with the calendula had a 7% healing velocity per week, as opposed to only a 1.7% in the control group. In addition, the researchers reported there was no adverse effects observed with the Calendula officinalis treatment. Early research shows using a calendula spray in addition to standard care and hygiene might prevent infections and decrease odour in people with long-term foot ulcers from diabetes. Calendula is heavily marketed in the treatment of eczema and dermatitis. However, the research on calendula for treating eczema and dermatitis is limited. Because the plant has anti-inflammatory properties, applying it to skin conditions might reduce the inflammation. The use of calendula might actually be irritating for young children with severe eczema, especially if they have an allergy to ragweed, daisy and marigold. Calendula use for children might be contraindicated, so always check with a physician before use. Using calendula creams on diaper rash might be advantageous when compared to certain ointments, such as aloe vera gel. However, research indicates calendula is inferior to bentonite solution. Researchers found when treating infants with bentonite, 88% of the lesions in the bentonite group started improving in the first 6 hours, while this rate was only 54% in the calendula group. Researchers compared the use of calendula ointment to a common drug used to treat bacterial vaginosis in 80 women who had been diagnosed with bacterial vaginosis. They found after 1 week of intervention, Both groups of women were cured of their bacterial vaginosis and none suffered any side effects. They concluded for the women who'd like to avoid taking drugs to treat bacterial vaginosis, calendula ointment might be a viable option. As for its effectiveness in treating yeast infections, one study published in Women and Health found the calendula cream was effective for treating vaginal yeast infection, but it had a delayed effect when compared to the standard medication. Though there have been claims that calendula can be used for the treatment of menstruation, further evidence is lacking to support this. The efficacy of calendula as a sunscreen was tested in vitro, meaning in a petri dish or a test tube. The idea behind the study is that the properties of the calendula as a cell rejuvenator might also hold true as a sunscreen. More research needs to be done in this area. Therefore, it's prudent to use only an approved sunscreen for UV protection. There's mixed research as to whether or not applying calendula to the skin can reduce radiation dermatitis or the skin irritation post-radiation therapy. It might not be better than petroleum jelly, but more research is needed on this. You shouldn't use calendula if you're allergic to ragweed, daisy, marigold, or plants in the Asteraceae family. Doing so could cause an allergic reaction. Women who are pregnant or breastfeeding should avoid calendula, because ingesting calendula might affect the hormone levels and induce menstruation. Anyone taking medication or scheduled for surgery should discuss calendula use with their physician first. It's hard to come with a generic dose for calendula, considering it's not approved by the FDA. Depending on the form and what you're using it for, the dose of calendula will be different. Before starting any new supplement, be sure to check with a doctor first. If you decide to grow your own calendula plant, you can get the benefit by drying the petals. The dried petals can then be used to make a tea or an oil. To prepare a tea, bring water to the boil, add dried flowers. For most people, that's 2 teaspoons. Pour the hot water over the leaves and allow to steep for 10 minutes. You could add a flavouring like cinnamon, vanilla, or honey if you like. For more on herbs, supplements, and natural treatment plans, check out my website.